Welcome to Apothecary Talks. I'm Dr. Jillian Stansbury. This is a series of short segments aimed at teaching actions of herbs to beginning herbalists to help create effective herbal formulas. Some of the skills for beginner herbalists are to learn your plant materials known as materia medica and learn the primary actions of some of those herbs as well as the specific niche indications. The specific niche indications include things that are warming or cooling or have energetic specificity or fit a certain pattern. A pattern recognition is an important skill of diagnosis and of herbal medicine because not all herbs are the same when it comes to antimicrobials, when it comes to stimulants, when it comes to diuretics. There's warming diuretics or cooling diuretics. There's soothing antimicrobials and tonifying things for the gut versus fairly powerful, harsh disinfectant type antimicrobials. They all have their specific niche indications. So when we're creating herbal formulas, we don't simply want to put everything we've ever heard of or read about or have seen recommended for diabetes or recommended for IBS or recommended for acne and put it all in one bottle. We like to think through what actions do we want our formula to perform. And in that manner, our formulas will be much more effective. For example, we might want to choose something for a digestive complaint that's stimulating to hydrochloric acid to treat digestive pain, or we might want to choose something that inhibits or limits or soothes digestive pain. That's a demulcent, and that is our topic for today to talk about demulcents. So a first step to becoming an herbal clinician is to master the various actions of herbs. And in this short segment, we're going to be looking at herbal demulcents. A demulcent are those slippery, slimy, soothing components in plants that can be used to soften the skin, to heal mucous membranes. Demulcents promote the healing of skin wounds, of ulcerative lesions. They're classic to use on sunburns or kitchen burns. Demulcents also can be consumed orally to soothe the pain of peptic ulcers, duodenal ulcers, intestinal or urinary lesions that might be ulcerative or irritated mucous membranes. Irritable bowel syndrome, colitis, to recover from gastritis, esophageal lesions that help us soothe the pain of GERD, gastroesophageal reflux disease, or simply sore throat lozenges, like slippery elm lozenges to suck on to soothe the sore throat. Many mucilaginous agents in plants will have a demulcent action. And so that's just a vocabulary point here. A demulcent is a verb. Demulcent is an action, an effect, a verb. Mucilage is that slimy stuff in plants, the material. It's a noun. And in these photos here are seaweed. Seaweeds are often fairly slimy due to the beta-glucans they contain. Or chia seeds. Chia seeds is an inexpensive source of natural demulcents. It's a great bulk fiber for the gut. It can be used to soothe digestive pain when people have acute problems with digestion, where you can mix it with oatmeal and create some very soothing stomach foods for people with acute peptic ulcer disease or other types of gastritis where very little else is tolerated. Rose petals are a classic source of mucilage and offer demulcent effects on the skin. Rose water is also classic for eye washes, just tired eyes, conjunctivitis and eye infections, actual grease splatters or burns to the eye. Rose water is a classic herbal formula that both promotes healing and just quickly soothes the pain. We also can use rose water as a base in our formulas for skin sprays, for sunburn or other kinds of irritation, shingles and herpes and bee stings, or other kinds of hot, stinging, irritated skin complaints. We also have aloe vera, another classic demulcent that is well known for sunburns. Aloe vera gels and topical applications for burns are a mainstay in first aid kits. You can use the fresh leaves as demonstrated here, or there's many commercial products on the market that are aloe vera gels and juices that you simply put on a cotton ball or soak a larger cloth in for a larger area of skin. And it can be used on simple sunburns known as a first-degree burn, or even second and third-degree burns. Some burns, of course, need to be referred to a physician as they're prone to scarring or prone to secondary infections. We can also ingest aloe vera for digestive complaints. It has a slight laxative effect, certainly a soothing effect on the intestinal and stomach mucosa. So aloe vera gel or juice has been used in teas and in various oral preparations. And it also has immune modulating capacities due to the mucopolysaccharides it contains that might be helpful for various inflammatory or autoimmune dysfunctions. Other demulcent herbs include Althea, that is mallow. Marshmallow and other types of mallow are in the Althea genus. Glycyrrhiza, that's licorice, has some mucilage in it. Tussilago means the cough dispeller in Latin, and that is another classic demulcent herb that has other actions, antispasmodic and anti-inflammatory and bronchodilating actions, as well as demulcent effects on the respiratory passages. Symphytum, that's comfrey, that is in the photo here or illustration here, and symphytum or comfrey is another classic demulcent agent that is often used topically on wounds or orally ingested for trauma, and it contains allantoin, a cell proliferating agent that speeds up cell division, so it helps wounds heal more readily while also soothing the pain, or can be taken internally for broken bones and other kinds of traumatic injuries. And then aloe and avena is the Latin name for oatmeal. For the best effects on the throat, esophagus, peptic, duodenal, urinary ulcers, we want to consume as teas that will be much more quality material delivered directly to the mucous membranes than taking just a few drops of tincture. Even though you can have tincture of tussilago and tincture of aloe vera, we're talking about getting tablespoonful doses, if not cupful doses, in terms of marshmallow and licorice and chia and oatmeal to really have surface contact with that irritated mucous membrane, so that oatmeal or that aloe gel has the chance to pass over the esophagus, to sit in the stomach and have a soothing effect. And also on the skin, oatmeal has been used. Beta-glucans are a naturally slimy mucilaginous compound found in seaweed that has a demulcent as well as immune modulating effect. So oatmeal plasters and poultices have been used on the skin just for cosmetic, aging, soothing effects, as well as medicinal effects, in addition to eating oatmeal. If you want to have more information, excuse me, I'm messing up my slides here. For more information, please consult my herbal formularies for health professionals, available from Chelsea Green, that goes into much greater detail on all of these herbs, as well as treating ulcers or treating gastroesophageal reflux disease or treating ulcerative lesions in the intestines and bladder infections and dermatitis and many things that demulcents are well suited for. I also lead ethnobotany field courses in the Amazon after having studied with several indigenous tribes over the last 20 years. If you're interested in joining me, please write to me at bghealingarts.apothecary@gmail.com. I also have a number of free content downloads available on my website, healingartsapothecary.org. There's links to other podcasts, webinars, recordings. There's some of my PDF files and beginner documents for your perusal. And I thank you for watching Apothecary Talks, and I encourage you to listen to some of the other actions of herbs on our beginner files on Apothecary Talks. Thanks so much for watching.